Is the dosing period for bispecific antibodies ongoing until progression, or is it for a set period of time?
Well, that is a great question. In the studies that have been done, like many studies, they're usually done until progression because you want to allow a person on a trial to continue to keep the drug going if it's working. In practice, what a lot of people are reporting is that they've had to stop the drugs for various reasons. And in many cases, the effect, if they've had a good one, is just persisting even while they're off the drug. So this is bringing up the idea that maybe when we start having more use, right now there's no FDA-approved one of these drugs yet in myeloma, but once we start having more experience, we might actually be able to start and stop them, which would be pretty neat.
On October 25, 2022, the Food and Drug Administration granted accelerated approval to teclistamab CQYV, the first bispecific B-cell maturation antigen, BCMA-directed CD3 T-cell engager, for adult patients with relapsed or refractory multiple myeloma who have received at least 4 prior lines of therapy, including a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 monoclonal antibody. How can I learn more about bispecific antibodies?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
Is the dosing period for bispecific antibodies ongoing until progression, or is it for a set period of time?
Most of the trials that have used bispecific therapies to date have used it ongoing, meaning that it's used continuously until either there's disease progression or death, or you stop it because of toxicity. That may not be the optimal way to use bispecifics. We do have some preclinical data that shows that perhaps giving bispecifics for a short period of time and then taking a break and then reinitiating might help in the recovery of those normal plasma cells and might actually be safer from an infection standpoint. That's not how most of the trials have been designed, but that is something that definitely should be looked at in the future.
So the dosing currently for the FDA-approved product, that is teclistamab, it is given continuously till disease progression. So we have a step-up dose whereby we can give it either, we currently do the 1-3-5 schedule. That means we split the first dose into day 1 and day 5, and then we give the first full dose on day 5, and then followed by that, it's going to be weekly dose till disease progression. So there's a lot of interest in understanding, can we modify the dose to every other week, especially in patients who have had a response. So we see that some of the newer studies are kind of already adapting that kind of approach.
So this is a really hot topic now in the treatment of myeloma. Currently, the trials we're looking at dosing until progression, which is kind of the way we go with the patients, both in the upfront setting and in the relapse setting. But I think with the very deep responses that we are getting, there are thoughts already of fixed duration treatment, and hopefully we will be seeing some of those studies coming up ahead. So if we have very, very deep responses, perhaps we are able to get sustained MRD negativity and then stop treatment, and patients might have a long treatment holiday without any disease. So that will be really great if we are able to achieve that.